Hi, my name is Garcia, he, and pronouns. I've worked in harm reduction spaces for several years now, and I'm a master's student in public health and social work. My presentation today is called Tobacco Harm Reduction is Harm Reduction. Just a bit of disclaimer, as of roughly a week ago, I was being funded by Knowledge Action Change to be a tobacco harm reduction writer for Filter Mag, and that position lasted about 2 years. I want to recognize we're talking about a legal drug here, nicotine. There's already a safe supply and it won't put you at a risk of an overdose. And pharmaceuticals are the same. They're guaranteed what they are to be, hence a safe supply. But there's no safe supply for drugs like heroin. Check out this drugsdata.org search result for heroin. It's anything but heroin. And right now there's safe supply for nicotine, but that could change if nicotine prohibition continues to be the focus. By banning safer forms of nicotine, we're barring people from safer options. It's no different than laws that target other forms of harm reduction like syringe exchanges, just like access to seatbelts, sunscreen, birth control, condoms, sterile syringes, and safer smoking kits. These are important public health tools, but so is widespread and equitable access to harm reduction for nicotine. We already provide the tools to reduce the harms associated with drug use. Nicotine is just another drug we can reduce the harms of. Many, if not most of the harms associated with drugs comes from policy. Lack of access leads to increased harms. We know this. And that's why it's important to support all forms of harm reduction. Not supporting all forms of harm reduction means supporting prohibition, which we know is ineffective and harmful. So an example of supporting all forms of harm reduction comes from EVALI. The states with the most liberal recreational marijuana laws had the least valley cases. According to a scientific study, their key outcome was that legal cannabis laws are associated with reduced valley incidence. What's the significance to harm reduction? Well, if nicotine bans continue to happen, there could be another valley, but it'd be due to nicotine this time and not due to THC. What's happening with nicotine mirrors the historical fear mongering and stigmatization of other drugs. A lot of these ideas are backed by moralistic puritanism, and vaping and misinformation is causing a false panic and sense of urgency around these nicotine bans. It's another example of the war on drugs in action. What happens if these nicotine bans continued? Well, like other drugs, prohibition encourages illicit markets, increases harm. EVALI and fentanyl are two really big examples. So I've seen this disconnect time and time again, whether I'm in either community, whether I'm at a city council meeting, conference, or a Zoom meeting. I feel like the lack of support comes from misunderstandings, misinformation, disinformation, and a lot of bad science. And tobacco harm reduction is harm reduction. And by using this word, we're essentially distancing ourselves from the larger movement. We shouldn't single out nicotine for arbitrary reasons, especially when there are policy implications, and it's led to some of the disconnect between these communities. We don't use the term OHR or SHR for opioid or stimulant harm reduction, do we? And so we should stop these arbitrary distinctions because we need each other's support. And this has led me to the question, why isn't harm reduction for nicotine as supported as harm reduction for drugs like opioids or stimulants? Nicotine and other drug prohibition is rooted in fear, bad science, misinformation, and disinformation. Misinformation is false or inaccurate. Disinformation is intended to mislead, and bad science, faulty science essentially leads to misinformation and disinformation, which leads to bad policies. So this is an example of the mis and disinformation I've seen from the Truth Initiative, for example. Heated tobacco products, aka vaping, is not proven to be safer than cigarettes. It's disinformation because according to science, you can't prove anything. It's not what science is about. And it's misinformation because according to existing evidence, this is simply not true. So as most of us know, the evidence base is well established. And what I want to highlight is that combustion versus vaporization is basic science. Why? Heating and or vaping anything compared to smoking anything is harm reduction, and that's basic science. No combustion leads to reduced harms compared to combustion. Basic science. I really want to stress that the notion that heating, not burning, vaping, and vaporization being different from each other is harmful. They are the same thing, and they should be treated as such. So this information is an example of the consequences of arbitrary definitions. If you look at the ones, they're essentially trying to separate vaping and vaporizing as something different. Yet again, vaping, vaporizing, heat not burn, it's all the same thing. And I want to highlight too the natural versus synthetic argument. It's a basis argument, doesn't impact health, and it's mostly used as a fear tactic. Here specifically, they're saying that because nothing synthetic is entering your body, it essentially protects you from the vaping related illnesses. And I feel like one of the biggest harms is the misattribution of legal vaping as the culprit of the so-called vaping crisis seen amongst both sides of the discussion. We now know it was a crisis due to drug prohibition as a result of illicit black market vapes. Despite this, I see the notion of vaping-related illnesses getting more and more traction. So it's unclear where these false notions came from, but it's likely from those with the most power in the industry or the THR space. So I'll give an example by Philip Morris International of bad science, misinformation, and disinformation that, among other factors, probably likely led to a vaping website saying that vaping caused the valley. And so it says here that their products rely on innovative methods. It's not innovative or new, it's vaporization. They're just vaporizers, and these arbitrary distinctions are harmful for nicotine and other drug harm reduction policies. It's unscientific, and I believe it's partially led to the disconnect between the harm reduction and tobacco harm reduction communities, and partly responsible for the tobacco harm reduction movement not being taken seriously by many, at least in my experiences and in larger harm reduction circles. I just want to point out that heating dry herbs is not new and it's literally been around for decades. Again, heating dry herbs is not a new concept and they've always been called vapes because what they do is vaporize. Makes sense. Here's another example of the arbitrary distinction trying to be made between heated tobacco and vaping. For all things concerned, they're exactly the same. And it's unscientific because there's no standardized definition for what vaping or heat not burn is. For example, heated tobacco devices use an electric heat control system. This implies that e-cigarettes or vapes don't have this function. But most vapes nowadays come with temperature controlled settings unless they're disposables. Most vapes, regardless of if it's for e-liquid, tobacco, cannabis, do this, and that's literally the point of these vaping devices, to prevent combustion and produce vapor rather than smoke. There's no meaningful difference between the two. Heat not burn is vaping. Vaping is heat not burn. It's all vaporization. It's all the same thing for all things concerned. Touting something as a heated tobacco device as something novel and completely different from a vape is disinformation and has led to misinformation. IQOS, for example, owned by Philip Morris International, says that despite having the same function, IQOS is not a cigarette or vape. I feel like this is an attempt to separate heat not burn devices from vapes, and again, they're the same thing. It doesn't matter if you're vaporizing a liquid or a solid, or an e-liquid or an herb. As said by Cambridge University, the process of turning something from a solid or liquid into a gas is vaporization. Similar definition from Britannica. So yet again, for all things concerned, they're essentially the same thing. They're both harm reduction tools that function via vaporization. And the form of a drug, whether it's liquid or solid, doesn't change its route of administration. This is basic science, it's basic harm reduction, and you're still vaping. So this notion is harmful because it's a seemingly deliberate use of science to spread disinformation because it's led to confusion. I feel that we need collaboration specifically between harm reduction and tobacco harm reduction communities, but this won't happen unless tobacco harm reduction is taken seriously. And for that to happen, we need standardization and basic science. And in this specific case with tobacco harm reduction, the change in substance is not harm reduction. The harm reduction is the route of administration, going from smoking to vaping, going from combustion to no combustion, going from smoke to vapor. That's harm reduction. IQOS is a vape, vaporizer, heat not burn device, whatever you want to call it. The concept of vaporization itself is nothing new, but I also want to highlight that negative framing shouldn't take away from the important harm reduction potential tools like this have to save lives. As a person who comes from a family of smokers, tobacco harm reduction is important to me, and this is why I stress that we must have standards as a movement and push the industries that unfortunately monopolize these products to act in an ethical and honest manner. So it seems like the vaping industry supports the stigmatization, misinformation, and disinformation campaigns against safer nicotine products. Here's another example from Vape Fuse. It says the recent vaping crisis is for liquid vaping, not dry herb vaping. Yet again, I want to stress vaping and vaporizing, heat not burn, they're the same thing. Don't buy into these marketing terms. They're the same route of administration and it's basic harm reduction information. And importantly, they're also using this information to say nonsense like, batteries are still exploding in people's faces. That's associated with vaping. And they're also saying that it's unlikely for you to overdose on nicotine if you're using natural tobacco. Like, that's ridiculous. Natural tobacco sources can have just as much or as little as a synthetic nicotine source. A drug is still a drug. And seemingly, a lot of this information comes from leaders in THR, such as Philip Morris International, that tout nonsense like vaporizing and heating is different from each other, despite both of them producing vapor. And of course, this information isn't as useful without a few nuggets of truth. Obviously, they're both smoke free. They're both vaporizers, but why use aerosol and not vapor? It seems a little confusing. And I believe these are fabricated, arbitrary definitions created for marketing purposes. I'm assuming that the thought is, vaping is associated with EVALI, so let's continue that negative association and just say that our heat not burn products are different. That's dishonest and harmful for our movement and the wider harm reduction movement. In order for all harm reduction policies to thrive, as harm reductionists, we need to speak up. We need to use science in an honest and unbiased way. That means acknowledging the pros and the cons. For example, acknowledging that vaping isn't completely safe, but despite that, it's a harm reduction tool. The confusion between heat not burn, vaping, and vaporization is concerning. It reflects the lack of standardization and science literacy amongst the THR community. Collaboration also means going to those other harm reduction conferences and learning together, working on policy change together. Importantly, supporting all forms of harm reduction will help end the war on drugs. If this doesn't make sense, inform yourself. Go to a city council meeting about harm reduction policy. Engage in political advocacy by volunteering for an organization working towards ending the war on drugs or drug prohibition. And lastly, we must collectively understand, respect, and uphold the roots of harm reduction as a social movement built on the belief and respect for the rights of people who use drugs. Yet again, my name is Kevin Garcia. Thanks for listening, and feel free to reach out if you'd like to chat.